Hi everyone. Today, we are going to discuss about anxiety. Nowadays, there are young adults who are suffering from this mental health issue. Firstly, let us take a look on what is anxiety. Anxiety is an emotion characterized by feelings of tension, worried thoughts and physical changes like increased blood pressure. Do you know how many types of anxiety disorders are there? The first one is panic disorder. You feel terror that strikes at random. During a panic attack, you may also sweat, have chest pain, and feel palpitations. The second one is social anxiety disorder. Also called social phobia, this is when you feel overwhelming worry and self-consciousness about everyday social situations. You fixate about others judging you or on being embarrassed or ridiculed. Thirdly, specific phobias. You feel intense fear of a specific object or situation, such as heights or flying. The fear goes beyond what's appropriate and may cause you to avoid ordinary situations. Besides that, how do you know if what you are feeling is anxiety? You will face excessive fear and worry, nervous or on edge all the time, panic or feeling out of control and even avoidance of going places or doing things. What are the physical symptoms? Your body tells you when it's feeling anxious. You may have shortness of breath, pounding heart, dizziness, headaches, sweating, trouble sleeping and trouble consent. Moving on, what are the causes of anxiety? The causes of anxiety disorders are complicated. Many might occur at once, some may lead to others, and some might not lead to an anxiety disorder unless another is present. Possible causes include environmental stressors, such as difficulties at work, relationship problems, or family issues. Genetics also one of the factors, as people who have family members with an anxiety disorder are more likely to experience one themselves. It also can be caused by medical factors, such as the symptoms of a different disease, the effects of a medication, or the stress of an intensive surgery or prolonged recovery, and brain chemistry, as psychologists define many anxiety disorders as misalignment of hormones and electrical signals in the brain. Withdrawal from an illicit substance can cause anxiety too, due to the effects of which might intensify the impact of other possible causes. What can you do to manage anxiety? Different things work for different people. Here's some stuff you can try to help you control your anxiety. You can educate yourself on anxiety and treatment options. Try to find out what triggers your anxiety so you know when it's likely to pop up. Challenge and replace anxious thoughts with positive ones. And also learn some relaxation strategies. Moreover, there are some foods that you can eat to ease your anxiety. For example, magnesium, omega-3 fatty acids, probiotics, zinc, antioxidant-rich foods, and B vitamins. What are the prevention of anxiety? There's no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to prevent anxiety happen on you. You have to get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. Stay active. Participate in activities that you enjoy and that make you feel good about yourself. Enjoy social interaction and caring relationships, which can lessen your worries. Avoid alcohol or drug use. Alcohol and drug use can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a support group to help you. There are some treatments to anxiety. In some cases, a person can treat an anxiety disorder at home without clinical supervision. However, this may not be effective for severe or long-term anxiety disorders. There are several exercises and actions to help a person cope with milder, more focused, or shorter-term anxiety disorders, including stress management, relaxation techniques and support network. A standard way of treating anxiety is psychological counseling. This can include cognitive behavioral therapy, CBT, psychotherapy, or a combination of therapies. A person can support anxiety management with several types of medication. Medicines that might control some of the physical and mental symptoms include antidepressants, benzodiazepines, tricyclics, and beta blockers. For those who are suffering from anxiety, remember that you are not alone. There are people who loves you and willing to help you no matter what happened on you. It takes some times for anxiety to recover. So, take your time. This is the end of the video. Thanks for watching.